That you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752. And when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And the foreword is written by Suzanne Summers. And we are halfway through the program, so the time goes quickly. Call now, 866-870-5752. What do you think, Dr. Darrow?
Well, we've got 3 callers waiting, Mark, Christina, and Thomas. So I think what we'll do is we'll start with Christina. And Christina, we're going to have to ask you to talk very slowly. We understand that your son has an index finger that's a problem. How old is your son?
Been like 3 weeks, and his finger is really swollen.
Okay.
And he's going to be taking X-rays.
Yeah.
So what would be the best thing for him to do?
Well, he's got to get the X-ray, it sounds like. How long ago did he hurt his finger, and how old is he?
About 3 weeks now. It's been 3 weeks now.
Okay. Please turn off your radio so we don't hear the echoing.
Yes.
And how old is your son?
He's 38.
Okay. And what happened that injured his finger?
He was playing basketball.
Okay.
And when he was playing basketball, I think the ball something got in his finger, and it's really like that was very swollen.
Okay. So if it's traumatic, he's got to check and make sure that there's no fracture. If that looks like it's swollen, if it's turned black and blue or something like that, especially, if he can move it okay, he's in good shape. But if one of the joints cannot move, then he may have torn a tendon to one of yeah, he needs to get that handled.
I told you to call you, but a lot of people doesn't believe in the stem cells and all that. And then
well, I'm not even sure that this is something that would help him. I need to get more information. But if you want to get him to the office, the number there is 800-300-9300. And
I will have him call you. And then I also wanted to talk to you about this doctor. My husband is a caregiver, and he's taking care of a doctor. He's a neurologist, and his wife is a psychologist.
Okay.
And I've been trying to tell her. I don't know how to tell her, but I told him to tell her, but he doesn't want to. And her husband, the neurologist, the doctor, he started having problems walking.
Okay.
And then they say that maybe it was because he was taking too much medication for the high cholesterol.
It could be. It could be the statin drugs. Yeah. The statin drugs can cause neurological problems and muscle problems. Those are to lower cholesterol.
He's getting all kind of therapy, and he's not getting better. So I was wondering, he would be a good candidate for her to talk to you. So I was listening to you were saying all those things, so maybe I was going to call. Her name is Rita, the lady.
Okay.
And I don't know
I'll be looking for it. Yeah. We're going to move on. We're going to move on, Christina. Thank you so much. I appreciate your call. God bless you. And I want to just comment about the gentleman you were talking about. If there's problems with balance and walking, it can be from statin drugs. But I didn't get the age of this person. As we age, sometimes there can be a lot of different problems that come up. You said there was a caregiver, which means that the person is probably elderly. Well, we're all elderly these days, right, Nita? What do we call it? Super elderly now?
No, I just don't like that word. I mean,
I know.
I just
It never fits anymore. We're in the new age.
That's right.
But at any rate, that's a complex issue, and I would need to see the person and figure out what's going on. There's just so many potential reasons for imbalance and difficulty walking, and I don't want to just take the time from these other callers to get into that. But Christine, if you want to email me, you can go to the website at www.lastemcells.com, and you can email me from any page there, and you can tell me in more detail about what's going on. I'm glad to help everybody I can. So, should we go to Mark?
Mark with a K.
Or Thomas? Which one do you like?
I already opened the call for Mark in Huntington Beach.
Thomas, don't go away. So, Mark, I understand your elbow and your hand are going numb. Tell me more.
Hey, Mark, are you with us? Mark, going once, going twice. Okay.
Don't cut him off. Keep him there, and let's go to Thomas and see if Mark.
Oh, there
he
you
is.
are. Okay.
There we go. Mark, Dr. Marc Darrow, but I spell mine M-A-R-C, and you spell yours M-A-R-K, I think, right?
Yeah.
I won't hold it against
One
you.
problem I have is with my elbow.
Yeah.
I was working on my car underneath and on the transmission, and I scraped it on the pavement. I didn't feel anything, and then about half an hour later, the little fluid sac swelled up like a golf ball.
Yep.
And I must have got some kind of infection in there when I scraped it, because then I got a bad staph infection.
Yep, you got it.
And it started turning red and going up my arm.
Yep.
And that kind of scared me, and first time I ever had that, and then I got some antibiotics, and that went away. But then every time I would just like bump my arm a little bit, that thing would swell up again. And it's been like 10 years now.
Oh wow!
It still kind of bothers me a little bit.
Okay.
And I'm just afraid, like, is it going to give me, if it's going to give me more problems later, and what I can do about it? Like, since I kind of ruptured that little fluid sac, I guess, in the joint. I don't know.
May I speak for a minute to this?
Yeah.
Okay. So the ulnar nerve is right along the groove. There's an ulnar groove right there. And then there's what's called the olecranon bursa that covers all of that. And it's very susceptible to blowing up like yours did when you scrape it or bang it or something like that. And the reason I think that is, I don't know of any study that proves this, but I'm pretty sure it's accurate from my experience, is that these bursa will sometimes contain some bacteria, not enough to cause an infection, but we do have bacteria all over our bodies, inside and outside. They're commensurate with us, meaning they help us and we keep them alive. They help us do certain processes, digestion and keeping virus away and all these kind of things. So they're not bad. But when you bang that bursa, the olecranon, which is the pointy tip of the elbow, then that drives into that bursa and can upset it. And I don't know if yours was scraped enough to open it up or not. It doesn't need to be. Then it just blows up like a little balloon. That bursa just blows up. And then the antibiotic you took got rid of it. But what I find often is a lot of people come in and they have these olecranon bursitis, and we just give them an antibiotic. They never heard it. It just blows up for some reason they're unaware of. It could have been in their sleep they banged it. Who knows? And the antibiotics often get rid of it. It's not a great idea to stick a needle into it because that'll irritate the bacteria that's there and open up an area and then really blow it up. So I would, if I were you, it sounds like you're still having some nerve damage from the ulnar nerve there. I would start taking about 50 milligrams of B6 every day. And sometimes that can heal the coating on the nerves, the myelin sheath.
15 milligrams of what?
50. B6.
Okay.
I'm not saying it's going to work. I'm just saying I would try that for about 3 months and see if it helps.
Okay.
There are times when a doctor who uses an ultrasound can hydrodissect that nerve that's irritated away from the bone. They just put a skinny little needle in there with some saline, and they push the nerve with the fluid away from the bone because it sounds like that's what's going on. If your hand is being affected, then it's probably the ulnar nerve. Is it your pinky finger and half of the ring finger that you feel the numbness on?
Mm-hmm. Well, my hands start going numb when I use it more for typing or working on my car, and then when it's usually when I'm sleeping, and it hurts so bad it wakes me up, and then it's just numb and it throbs.
Okay. Did that start after you scraped it, or did that start later?
No, not really. This is just recently with the
okay. So it might not be related to that bursitis infection you had. It may be something that's come on just from overuse of your hands. It may be carpal tunnel syndrome. It may be coming from your neck. The way you find out is you do what's called an EMG and a nerve conduction study. Neurologists do those studies. If you came in, we could order it for you and send you out to have that done and find out where that nerve is being impinged on. What I would try is getting a wrist brace first and wearing it as much as you can, especially while you're sleeping. Okay, the wrist brace is one of those big black things with the Velcro that goes all the way from your fingers up almost to your elbow, not just a little thing around the wrist. It's got to immobilize the motion of the wrist. Okay? We're going to move on, Mark. I appreciate your call. God bless you. And Nita, anything to say before we go to Thomas?
Thank you, Mark, for your call. Our number is 866-870-5752 right here in the studio, and you get Dr. Darrow's book for free, Stem Cell and Platelet Therapy. Regenerate, don't operate is the byline, so give us a call. Ready to go to Thomas?
Thomas, Dr. Marc Darrow, how are you today?
Pretty good.
Good. What's happening?
Well,
your neck
really.
bothers you.
That's why I'm calling you.
Well, I like the way you started out pretty good. You got to keep it that way no matter how you feel, right? So how long has your neck bothered you for, Thomas?
Well, this episode with it right now, I started with a feeling of a stiff neck.
Yep.
It's been months ago.
Okay.
I've gone to the doctor, and I took some pills, to relieve the pain.
Were they anti-inflammatory pills, or were they muscle relaxants?
Right.
Okay.
Right. And he told me to shift over to this tropical gel.
Okay.
Which I've been using for about a month.
Okay. Do you remember the name? Do you remember the name of it?
Yeah. Well, it starts DIC.
Diclofenac.
Yeah.
Yeah.
Okay.
It's an anti-inflammatory. It is better to take it locally on the skin, like that transdermally. You put it on the skin and then it's absorbed. Much better to do that than take it by mouth, because when you take it by mouth...
Well, and it works instantly, and it relieves it.
Wonderful.
And then I put it on. I make sure I put it on overnight before I go to bed, because if I don't, when I wake up in the morning, I've got a real stiff neck.
Okay.
If I lay the wrong way.
Yep. So I would prefer, if you were my brother, or maybe you're old enough to be my father, or young enough to be my son.
I'm probably old enough to be your father.
Then you'd have to be about 95, but that's fine. You don't
well,
sound
I'm 81 then.
Good for you, man. You sound younger than that. Good for you. So if you were someone that listened to me, I wouldn't be taking that gel every day. I would fix it. And the way you fix it, it sounds to me, is you have a ligament sprain in your neck. Did you ever sprain an ankle, Thomas?
No, but this neck area, and when I was 18 years old, I was in a car accident. I had 3 crushed vertebrae in this area.
Yep.
And the doctor said, you won't have any problems with this until you get older. Here I am older.
You're not older.
I've gone to
when you're 100, you'll look back and think you were younger.
Yeah. Just think young. I was a year ago, but no.
You were young a year ago, and now you got old in 1 year.
You get old. You get old age pains. But the thing is that I helped somebody move with this thing, and 3 years ago I went to the surgeon because I had a feeling in my left shoulder. It was no pain. It was just a feeling. He evaluated me, and he says, "Well, you don't need surgery." They did an MRI, and it showed one of the discs actually penetrating into the spinal cord itself.
Okay.
Still, I didn't have any pain. I did weight exercises and everything.
Sure.
And I helped this person move, and I was carrying a couple bags up the steps.
Okay.
And my shoulder started burning, like something tearing your muscle away.
Yep.
As I walk up the steps, and I had to quit. The pain got so severe.
Okay.
And
guess what, Thomas? You've been talking enough, and it's my turn. So let me talk a little bit and tell you
all the information.
Oh yeah, I bet you did. So stiff neck typically is the ligaments. Okay, you're not talking about pain going down your arms. The herniated disc is really not an issue. Okay, a herniated disc is an issue when it's radiating pain down the arms or legs, but an anterior herniated disc is usually not a problem at all. If it was hitting your spinal cord enough, you wouldn't be walking, and that's not happening. So I don't think that herniated disc is an issue. I'd have to examine you to know, like I always say, I've got to examine. It's like, what are the three most important things about real estate? Location, location, location. In medicine, it's examination. Not looking at a map for real estate as much as looking at, in medicine, not the MRI, not the X-ray, but touching the area, okay? So I think there's good hope for you. I don't know for sure until I touch the neck, but I wouldn't be taking gel every day if you can get a few injections and fix it. And we would probably just use PRP, which is platelet-rich plasma, do a blood draw from you and inject the platelets right into the area where the pain is and get rid of it. I've had it done to me. Nita's had it done to her. We've both been successful with feeling better.
That's right.
If you saw my neck on an X-ray, which does have herniated discs, and you were a surgeon, you would want to operate. Okay? I have a lot of things in my body that surgeons would look at without touching me and say, you need surgery. I'm not doing it because I don't need it. So don't look at the MRI or the X-ray to decide what you're going to do with your life. Anyway, Thomas, we have Patricia waiting. God bless you, Thomas. I love you, and it's great talking to you. Patricia, your knees and back bother you? I'm going to give out our phone number here to get some more callers before the end of the show. To call me and talk to me right now, it's 866-870-5752. Grab your pen. I'm going to repeat it for you. It's 866-870-5752. And if you want to call my office, there are people there that can pick up phones also. And that number is 800-300-9300. That's 800-300-9300. So, Patricia, your knees and your back hurt. For how long is that?
Well, my back has been hurting for about 5 years, but now it's worse.
Okay.
And I'm bent over.
Oh, boy.
And I can't walk well without a walker.
Okay.
And I use a cane also, sometimes without the walker.
Okay.
And I walk a little bit around the house without the cane or a walker sometimes. But then the pain gets so much, I have to sit down.
Okay. What did your doctor tell you about that?
I don't know the doc yet.
Patricia, you phased out for a second. I don't know if you're on a Bluetooth, but please repeat.
I really haven't got a good take on a doctor yet.
Well, have you been to a doctor for it at all?
Well, when it first started, I had a disc problem.
Okay.
And I never got it fixed or anything.
Yeah.
So
a doctor did an MRI and looked at the discs or an X-ray?
Yeah, I believe so. I think I have them still, but that was 2 or 3 years ago.
May I explain what disc problems are?
Can you explain it?
Yeah, may I? May I speak?
Well, I want to say first that I have like what do you call it? Crepitus?
Crepitus. Yeah. Okay, well, we're not on the knees yet. We're still on the back, and then we'll get to the knees. One thing at a time. One thing at a time so I don't get too confused. So let's deal with the disc problem. Discs are little cushions between the vertebrae all the way from the neck through the thorax and down to the lumbar spine. And I get people in all the time who say they have disc problems, and they don't have disc problems. They may have degenerative disc disease where the discs start drying out, but they're not the cause of the pain. May I ask, Patricia, about how old you are?
I just turned 81 in November.
Why do you laugh? We'll all be there soon. I don't look at that as being old. I've got a lot of patients in their 90s who are as active as people in their 20s. So,
that would be nice. That's what I want. Yeah.
Okay. So
not in my 20s even, in my 30s, whatever.
Well, that'd be good. I'm 16, so, we can all choose our age. So
you're the lucky one.
I'm lucky because I choose that, and you can be lucky too if you choose that. It's all a state of mind. So for your back, I would need to touch the area and move you around in order to tell you what is going on and whether I can help you. Sometimes with things like that, I've had people all bent over and we do regenerative medicine, and all of a sudden, after a treatment or two, they're standing up straight. I'm not telling you that you're that person because I haven't examined you yet, but there's a reason you're bent over. You may have had some fractures in the vertebrae from osteoporosis. Okay? I have to look, I have to see. And there's things that can be done for that also if that's the case. Have you ever taken bioidentical hormones or any kind of hormones?
No.
Okay. So as we age, our hormones decrease and our bones then demineralize. And the best thing to do for you is to get what's called a bone density. We can order that for you and see how your bones are. Because you still, even at 81, may want to start taking estrogen, progesterone, and testosterone to save your bones because they stimulate bone growth. Okay? I know there's a lot of information all of a sudden, but if you were to come in, I have a book that I wrote on hormones also, and I would give that to you, and we could see what's going on. Okay, so let's move from the back to your knees, and what's going on with that? You said there's crepitus, meaning grinding in your knees, and what did a doctor tell you about that?
Also, they're crunching, and they're collapsing beneath me. I don't want to say just that they're giving out on me for a second, and I straighten back up because I don't know. It actually feels like a collapsing.
Okay.
When I'm at the sink doing dishes or something, they collapse on me, and if I didn't have my arms on the sink, I would be falling down.
Well, I'll give you a prescription not to have to do dishes anymore. How's that?
Oh, thanks.
What did your doctor tell you about your knees?
Oh, I haven't been to a doctor for knees.
Okay.
Oh yeah, last time oh God. He said, "Why did you wait so long? Now you will have less movement."
Yeah.
If you did an operation, knee replacement, you would have less range because I've waited so long.
Okay. Well, I don't know if that's true. I wouldn't know unless I examined your knees. I have an ultrasound that I'd look inside with and see what's going on. And I'd move your knees around and touch them and see what's happening. If you want to come in, the number to the office is 800-300-9300, Patricia.
Okay.
And we can check into all these things that are bothering you and hopefully give you some relief. I don't know until I touch the patient and see what's going on.
You don't know what?
I'm sorry?
I can barely hear you. I don't know.
Oh, I'm sorry. I need to examine your body, touch it, to tell you what's happening. Patricia, thank you so much. We're ending the show at this point. God bless you all. Nita Valens, thank you so much. And Suzette and Alex and the rest of the crew, God bless you all. It's been a great show. Call me at the office, 800-300-9300. Go to the website, watch me do these videos of me doing procedures, www.lastemcells.com. Nita, anything for you? Too late.
See you next time. Thanks.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.